So there's about 1,000 CF patients in Michigan. There are 5 centers, and the size of the centers are different. In Michigan, in University of Michigan, there's about between 250, 275 in pediatrics, and about the same number in adults. So the adults are gaining on us. So they used to be 1/3 or 1/4, but now we're equal numbers. What I do, I do a lot of things. I only have one clinic a week, thank God. And that's Wednesday, as most of you know. However, I take care of your kids. And I do a lot of research, especially clinical research. So I'm very interested in adherence and working a lot with my junior faculty and fellows on that right now. I also do a lot of international stuff. So I usually I'm originally from Egypt, so I go to Egypt frequently, and I'm very proud to say that now they believe me, and they do have CF patients there since they started testing. And I actually talked with the foundation to see if they can help out somehow with the documents, at least, for the Egyptian population, because we have quite a bit. One center has 160 patients, and the other one has 60, and we just started testing. So I'm very proud of them for taking it on, because they initially believed that CF does not exist in Egypt, but they were wrong. So that's part of my passion as well, is to work with the Egyptian physicians to help the patients there, and I think we've been doing some differences there too. So that's kind of a nutshell. I love taking care of the kids. They teach me every day. I see them. I learn a lot from them, and no, they are not normal people with CF. They are really, I say that to my kids all the time, is that, they teach me. I feel like, you're not only a child with CF or a young person with CF, but you have to do a lot of things to stay healthy. So one of my patients said, I don't think about CF every day of my life. It doesn't run my life. I knew that he wasn't doing his medication, and he wasn't. So finally, he now have a song about how you should be adhering to your medicine. It's actually on YouTube, and it's very good. So it's really about laughing with them, learning with them, about sharing my information. It's not, I love, when I go to Egypt, it's like whatever you say, they listen to you. Here, no. Little kids would be arguing with me. So I love it. It's nice, it's fun, we are a team, and we work together and have a lot of respect for the parents, and more importantly, for all people with CF, for all what you guys do, and the effort, and leading on, and carrying on, and doing everything you want to do. By the way, we have a ladder for college. We have ladders for travel. We have ladders for whatever you think of. The nurses love me because I always promise things and then go to them and say, oh, by the way, can you do this ladder for me? So, and it's all about the CF patients. And I'm sorry if patients offends anybody, but this is just me talking all the time. But anyway, love my work. And this is really very important, because if I don't, I would be out by now. But I love it, and I'm planning to stay working for a while. So. And by the way, Dr. Johnson, I knew him before he defected to the other side, which is Genentech. And he's been doing an amazing job with Pulmozyme for years. And when I heard that he moved to Vertex, I was very excited, very compassionate, very great guy to work for. And to have him in CF for all these years is amazing.
How do I say? Thank you very much indeed. So, but what you say is true, because for those of us who've been in CF for a long time, when you go to the CF meetings every year, you see the same people, and it's very unusual, I think, in medicine, with such a small disease relatively compared to all the other things that we could be interested in. What is it that keeps us attached? Well, it's obviously the friendships that we form with our medical colleagues, but it's also, I say it again, it's the community. It is an amazing community to work with and for, and I think we're all very blessed to be able to do that.